Hey guys, I'm going to go ahead and do chapter 9 online for you. This is one of the most, it's an important organ system, so I want to make sure we cover it, this and at least cardio. So I'm starting around page 145 if you want to follow along here. So the nervous system, it's more than just your brain and your nerves. It's actually where the motor system, or how our body is controlled, is found. It's responsible for maintaining homeostasis in terms of signaling hormone release, reacting to stimuli, taking in information from the environment. Funny enough, the brain is the only organ to name itself. Anyways, but in general, you can break the nervous system down into two major portions here. Alright, so two major branches of the nervous system. It can be broken down into many levels, but when you do that, it's a little bit easier to understand. And it's sort of broken down by whether it's taking in information or putting out information for your body to have an effect on, or whether it's running something that is automatic for you, like involuntary reflexes, things like heartbeat, respirations, and then other things that you can control. So initially you can break it down into the central nervous system. That's what that stands for. And the peripheral nervous system. Okay, so the central nervous system consists of your brain and your spinal cord. Okay, peripheral nervous system is everything else, basically. And by everything else, I mean your cranial nerves, your spinal accessory nerves, sensory organs, so on and so forth. Okay, but brain and spinal cord. One thing that people tend to get mixed up is your cranial nerves. If you'll look at page 158, and I don't have the brain model in front of me to show you. Actually, I'll get it. Hang on a second. So maybe you can see, like here's your olfactory nerve that's going out. This is your brain, fits in your head like this. And so this cranial nerve is your olfactory nerve. It's going out to your smeller. You've got your optic nerves right here. Okay, these are cranial nerves. They're part of peripheral nervous system. They look like they're made and part of the brain here, but they're actually not part of the CNS. So cranial nerves are peripheral nervous system, not central. Okay, cranial nerves are peripheral. And you can see a picture of those on 158. All right. So from CNS, we can break it up into two more levels. And it's called Efferent. Let me zoom in here. Alright, so we're going to call this motor or efferent, having an effect, or it's the effect that's caused by a stimulus. Division, and it can be broken up into two more smaller divisions, one called somatic which is just another word for body. If you ever heard of the muscle relaxer Soma, it's a skeletal muscle relaxant, and it keeps you feeling loosey-goosey. Well, it's because it works on skeletal muscles. And then there's Autonomic. All right, and this is everything that's controlled automatically by your body. You can break this one up into two smaller, still yet subdivisions, or divisions of sympathetic and parasympathetic. This is your fight or flight and your rest and digest portions of your nervous system. So sympathetic, that's the one that is fight or flight. So one is fight or flight. And parasympathetic we call rest and digest. And we'll know why we call them that a little bit later in the chapter here. Okay, but we're just trying to get a division of these so we can start to make sense of them. Okay. I'm going to take this one over here so we can see. I have a little bit more room to the right. So the peripheral nervous system, yes, it consists of everything else other than the brain and spinal cord, but it can be broken down into subdivisions or smaller divisions as well. All right, and so like here is your motor. On this side, it's going to be called the sensory. It's the main division of it, or afferent. All right, it can be broken down into visceral, and somatic. Okay, so if this side is motor, meaning we have somatic, that would be me moving my body, locomoting, moving my arms and legs and things like that. This motor over here this somatic over here is a little bit different, because in this one information is flowing to the brain, just like the diagram shows. It's receiving information from your sensory organs, hot and cold receptors in your skin, pain receptors, and it's going to travel back up here to this main part of your system, and then have an effect down here somewhere. Okay, if you're feeling hungry, your stomach is going to release some hormones to signal to your brain that you need to go eat after that point. Okay. This page 146 gives a good diagram of this, and that's what I'm coming off of. So if you can kind of come back to this and know these divisions of the nervous system, their job, you'll do well. But it's important that you study this. Let's talk about so we've looked overall at the system like we have the other ones. We looked at some of the big parts of it. Let's look at the cells here. And the basic cell in the nervous system is a neuron. All right, and it has about 3 main parts you need to know about, with a couple other extras. These ends right here we call dendrites. Okay. If you notice, they're kind of spindly looking, like a tree branch almost. And it makes sense that they look like that because of their function. So here's my cell body, my little nucleus, and then we have these dendrites coming out here. And dendrite, okay, that is the Greek word for tree. And it makes sense because they sort of look like tree branches without the leaves on them. And this end of the nucleus, or I'm sorry, this end of the neuron, this neuron has two different ends to it. Okay, this is the end that is usually receiving info, and information will travel this way. And this axon, this other third part, okay, you got your dendrites, axon, you've got your dendrites, cell body, and axon, three main parts of it. This axon is carrying information to your brain, or it's carrying it somewhere else, wherever that cell is leading to. These axons can be very long. Like you can have one from your large toe heading way up to your brain. They can be very long, or they can be very short. But usually dendrites information is received here, and they've got lots of surface area for receptors and things to receive that information. You can imagine these are a lot more dense on your fingertips, where you can discern between a small point or a blunt object, or something soft, something hard, something cold, something hot. You need a lot of these to receive that stimuli from the environment. And then the cell body's here, and that information is going to be sent down this axon to somewhere where it can be processed and used for something. This myelin sheath here, okay, this is like a fatty covering on these axons, and what it does is allow that signal to travel a lot faster than it normally would without the sheath. Okay, in diseases like multiple sclerosis, or multiple sclerosis, this myelin sheath becomes degraded. It starts to form bad. These cells are misfolding these proteins and stuff in here, and so you get those symptoms of disconnected circuitry for movement, either paralysis or real jittery movements. Okay, but myelin sheath, that's where some of those diseases are focused at. Is this sheath right here is not healthy. And actually, gray matter, ever heard the saying, the gray matter between your ears, talking about your brain, it is unmyelinated. And so if it is myelinated, that means it's white matter. So white matter is myelinated, gray matter is unmyelinated. Hint, hint, hint. Okay, so now the three main parts of the cells. Still looking at just some parts of the nervous system. Your brain and your spinal cord are covered with some membranes that's called the meninges. You heard of meningitis, that is inflammation of the meninges. And they're in three layers. This pia mater is the innermost, most delicate layer. This arachnoid is the one in between it, and it's like a cottony, I'm going to show you a video of it here on YouTube in a second. It's like a cottony, looks like a spider web basically. And this dura mater is the durable, hard covering, okay, and it's the outermost. You should know the order of these and the names of them and some of the characteristics about them. Periosteum is that membrane we talked about in skeletal system, covering the bone. And then our skin, you can see this layer is laid out here. Here's a picture of the dura mater. It's this tough membrane they're pulling back here, and you can kind of see the arachnoid mater. It's like this clear substance in between these, in this sulci here, sulci. Sulci is the deep grooves, and gyri are the ridges in your brain, and it's kind of like a cottony web that holds that together.
So what you're looking at now is actually the brain. It has been opened, section. You can see the bone here. This is the brain. The beauty of the brain is it's really held together by spider web-like structures. It's called the arachnoid. It's this very, very thin film that you see here. It's a little thicker right there. It's right here. It's transparent. And then the brain has a lot of folds in it. And so what we've done here is we've opened this very large fissure, which is called the Silvian Fissure. And by opening this fissure, we have vessels that lie within it that are then exposed, and these vessels are called the middle cerebral artery vessels.
Okay, and then right here we have some skull, and we have some skin here. I'll show you that video here in a second if I haven't already put it up on the screen for you. So we've got some meninges, some divisions of our nervous system: central, peripheral. Central is broken down into two more, which would be somatic and autonomic. And then peripheral nervous system is broken down into visceral and somatic. Autonomic can be broken down into two more, sympathetic and parasympathetic. Three parts of our cell, three meninges, and now we're going to look at a couple lobes of the brain. These areas in your temporal lobe, one side is for speaking, communicating, one side is for taking in information. So some people have a stroke on a certain side. They can understand what you're saying, but they can't respond to you. They might try to speak. Some of them might just try to speak and be like a word salad that comes out. Some of them may not be able to speak at all. And then if it's on the other side, they may sound and speak just like normal, but they can't comprehend anything you're saying. Both of those situations can be really frustrating for both people in that communication scenario. But if you've ever spent some time around any Alzheimer's patients or patients with stroke, you'll know what I'm talking about. The brainstem, the lower you go in the brain, the more primitive and the more automatic and more important the functions become. So down here in your brainstem, we'll break that down here into a few parts. This is where your heartbeat, respirations, blood pressure, all of that is controlled. And then going up just a little bit, your cerebellum. This is where your balance, coordination keeps you sitting upright whenever you're not even thinking about it. These muscles are tight. Back here in your occipital lobe is where vision is processed. Okay, so you can kind of see that lobe right there. And your two optic nerves enter here and they cross. So you're actually processing, if this is the right side of this brain is turned around for you and for me, this is the vision that you're receiving from your left eye. And then the left side of the brain is receiving vision from the right eye. Your brain is smart enough to flip that vision over and to correct it for you. The occipital lobe is where your sight is processed. Okay, people have tumors back in here. I had one patient once in Dr. Hodes when I worked with neurosurgery up in Louisville. He was looking down at the scale and he would only see part of the numbers on the scale. And so he thought he'd come and get checked out. And he actually had a tumor back here in his occipital lobe that they were able to take out. Parietal lobes, these large areas up in here, is where we get things like our touch sensation is processed, language, fine motor movements. The frontal lobe is where we get our mood. So people who have strokes in the front or brain injuries in the front can be quite moody. They can be almost mean, you would think. It's because they're not able to process or to experience a mood and understand it like we would. The reason how they discovered this was, one of the ways they discovered this was there was a guy that worked on the railroad back in the 1800s who had some sort of accident where a spike went in one of his eyeballs and came out to the top of his brain. And when they pulled it out, they noticed that he wasn't a big joker like he used to be. He used to tell jokes and cut up a lot. When they pulled it out, he was kind of a serious dude, and some would say he was almost just kind of like a mean guy. But after he died, they did autopsy, and they figured out that it was a frontal lobe that got really damaged here, and it affected his mood. And so shrinking of this lobe and strokes and things that are a problem up here can cause problems in that area. But those are the main parts. They're listed right here: frontal, parietal, occipital, and temporal. I'm not going to ask you about the insula and cerebellum. Make sure you know about the cerebellum, which is the tiny cerebrum. Okay, the brainstem, on the other hand, this alien-looking thing here, is broken up into three main parts: midbrain, pons, and medulla. Okay. Your midbrain is in the middle of the brain. And so information that's processed up here is sent to this area. It kind of makes sense, right? It's going to be near each other. Your pons, okay, the connection between the brain and the spinal cord is right in here. And then your medulla is just a little bit lower, right in there. Okay, they're kind of colored differently here. So in your medulla, that's where this cardiac vasomotor, which is what controls your blood pressure, and your respiratory centers are there. So you can imagine a stroke or a tumor or some kind of illness in your cerebellum would be hard to operate on, and it would be dangerous for them too, especially one that's near your brainstem and near your midbrain. Those are almost always inoperable, I would imagine. Okay, and so everything we just described here recently is part of your central nervous system. Cranial nerves. All right, so let's look at this parasympathetic for a second here. Rest and digest means your body is going to shut down some processes and kind of magnify other ones. So they're not going to be shut down, but those will be sort of quietened down or quieted a little bit, and then other things will be amplified. So rest and digest means you're not making, we'll see, parasympathetic. And if you look at this diagram here, under parasympathetic, constricts pupils, stimulates tear glands, strong stimulation of salivary flow, stimulates stomach motility, and secretion stimulates pancreas. So these things are being stimulated, stimulates intestinal motility. These things are being ramped up. It means digesting. You're starting to digest. And so after you eat a big turkey dinner on Thanksgiving Day, parasympathetic system is going to start working. Increasing saliva, increasing digestive organ action. You're going to start increasing your production of urine. Okay, your body's like, well, we can get rid of some waste while we're here working. See, it says relaxes bladder neck. On the other hand, though, sympathetic this is fight or flight. So you see things like your pupils are dilated. That way you can see the enemy coming to you. If it's nighttime, you can see more light is allowed in, so you can see a little bit better if you're in that fight mode. You don't have any need to make tears at that point because you're in a sympathetic reaction here. You don't need saliva. It's when your mouth gets dry, you're nervous. Heartbeat is going to increase. Constricts areoles, but your bronchi are dilated. You're going to need a lot of air to run, or to fight. So you can imagine like an inhaler for asthmatics might work on this sympathetic part of your body. It might have some receptors in there that's keen to accept that medicine and dilate bronchi. You don't really need to be digesting anything at this point. If you stay in this period for long enough, you're going to get constipated, inhibits intestinal motility, and you have really no need to make urine at that point either. So you can see these things are kind of shut off as they were over here. They were turned on. So fight or flight on sympathetic. Make sure you get those two straight, okay? I'll let you read over this part right here. Some of these diseases: Lou Gehrig's disease, also known as ALS. Terrible disease. I've known a few people who have suffered from it here. My parents had a really good friend, Dean Bertram, who died from it. He was a healthy guy riding motorcycles with him at 40 years old, and then he got diagnosed. And then after, I think he lasted about 2 or 3 years after that. But the first year he wasn't able to drive, and then the second year he needed somebody to feed him. And by the time he was passing away, he was bedbound, pretty much paralyzed at that point. It's a slow, kind of agonizing death. This right here, Bell's palsy, is more of a localized type thing. It can be because of a nerve, maybe like a tumor in the trigeminal area that causes movement and sensation for that part of your face. We had one guy, when I was in oral surgery, pulled out a big molar back here, and he just couldn't get better from it. Like weeks and weeks and weeks. We were treating him for a dry socket, putting that clove stuff down in there, and this guy just wasn't getting any better. So Dr. Cieslak sent him for an MRI of the head, and sure enough, he had a little benign tumor right there on that nerve that was causing some of those issues. May have been why he even needed that tooth out. I can't remember exactly. He must have thought the tooth was causing him pain, but really it was that nerve. Strokes. You can either have a stroke where there's been lack of blood flow there, which has caused that tissue to die, or hemorrhagic stroke, where it's bled out from overpressure and pushed onto that tissue hard enough to where it's caused damage. I talked about multiple sclerosis and the myelin sheath. I'll put these online for you to review here. Parkinson's disease, that's a big one. But make sure you read over this chapter. I've hit the main parts here. I would really make sure I understood what parasympathetic was going on in between these two and what those effects are. And make sure you can understand the divisions in this nervous system here, okay, between CNS and peripheral nervous system and their subdivisions. All right, thank you all.